Amid the COVID-19 pandemic and the awakening to systemic racial bias, the notion of health equity is rising on corporate agendas. Companies are now questioning what they can do to help close healthcare gaps and achieve health equity for all. This is Business Interrupted, insights on the new now with EY. Today, the economic impact of health disparities and the importance of striving for health equity. I'm joined by Dr. Yele Oluko, EY Partner and Chief Medical Officer, as well as Adodo Enebulele, EY Principal, Consulting Practice. Dr. Oluko, Adodo, great to have you both with us.
Happy to be here.
Good morning, Caroline.
Dr. Oluko, recently we've been hearing a lot about health disparities and health equity. Can you please help explain the difference?
Health disparities refers to the observation that similar groups of populations of people may experience different outcomes within the healthcare system. So what do I mean by that? If you have a group of 100 Caucasian men and compared to a group of 100 African American men that both have the same diagnosis of congestive heart failure, and if you observe their trajectory over 5 years, the observation is likely to be that there'll be more deaths in the group of 100 African American men and less deaths in the group of 100 white men. So what we have seen is a disparity in outcomes in two groups of people that are different by way of racial demographics. Now, health equity would be the observation that both of these groups would have the same outcome with the same disease process. In other words, there'll be the same amounts of death in both groups. So health disparities highlights the differences in outcomes, and health equity is an aspirational situation where we expect that each person in society would be able to achieve their full life potential and there will be no disparities.
Adodo, can you share your perspective on how workforce health impacts businesses?
When we talk to our clients, there are really three areas that routinely come up in those conversations related to health and wellness for their workforces. The first one is that a healthy workforce improves productivity and allows businesses to operate better. The second has to do with key factors around social determinants of health, which include but may not be limited to physical location, where people live and play, potential discriminatory practices, whether they are race, gender, or orientation related, and healthcare, which has to do with the access to care and the affordability of care. The third area is that a healthy workforce minimizes disruptions and allows businesses to operate in a stable and sustainable fashion.
Dr. Oluko, how can companies start to tackle health disparities and develop a strategy to achieve health equity?
We've developed a point of view at EY that helps our healthcare clients understand the severity of the problem. We help them understand that it's important to track performance within the health systems across racial demographics, to identify gaps in performance, and to identify gaps in outcomes. Once that's done, we also provide them with insight how to close the gaps. Now, for our clients that are not healthcare clients, we encourage them to be aware that health disparities actually exist in their workforce. By so doing, they're able to ensure that they put process in place that vulnerable populations within their workforce have insight about the potential for health disparities and that they get equitable care at the right price.
Adodo, the pandemic has led to the broader use of digital technologies. How do you see these technologies playing a role in addressing health disparities?
One of the things that we do know is data does not see color as long as it's used uniformly across all races. We help our clients leverage data and utilize technology and digital tools to not only uncover health disparities in the workplace, but also promote health equity amongst their workforce.
Adodo, if you could leave our audience with one key takeaway, what would it be?
As businesses focus on their healthcare spend, they should feel empowered to leverage technology tools to not only address the health disparities that they see within their respective organizations, but also promote health equity within their workforces.
Dr. Oluko, what's your one key takeaway?
It's a moral imperative that all businesses and all society comes together now to dismantle the relics of systemic racism that have directly resulted in health disparities. And the time to do so is now.
Dr. Aluko Adodo, thanks so much for your expertise and for joining us. Really appreciate it.
Thank you very much.
Thanks, Caroline.
And we'll see you back here soon on Business Interrupted, Insights on the New Now. You can get new episodes of Business Interrupted at cnbc.com/interrupted.